my name is Mallory, and today I'm going to talk to you about how to overcome SVT. Let's start with the basics. What is supraventricular tachycardia? Supraventricular tachycardia, also known as SVT, is an arrhythmia or rapid heartbeat. SVT is by far the most common congenital heart disease in infants and children. They may experience heart palpitations, random and sudden rapid heartbeats, chest pains, dizziness, and rare fainting. 35 out of 100,000 patients are diagnosed with SVT, and it occurs in 1 in 2,500 children, according to Mott's Children's Hospital in Michigan. I was one of the 1 in 2,500. As I'm speaking to you, I know that not everyone suffers from supraventricular tachycardia, although I'm sure you have experienced a racing heartbeat at some point in your life. Although your heart may be racing, that does not mean you are experiencing the same problems as those diagnosed with SVT. From the time I was 9 years old until I was 14, I was experiencing those symptoms. At age 14, I was officially diagnosed with SVT. Fortunately, supraventricular tachycardia can be reduced or eliminated in many different ways. With that being said, I will inform you on ways to overcome SVT. I will talk to you about the causes and prognosis of supraventricular tachycardia, ways it can be avoided, and how it affected me. There are many different causes of SVT and how it can be prevented. For some people, a supraventricular tachycardia episode is related to an obvious trigger, such as psychological stress, lack of sleep, or physical activity. For others, there may be no noticeable trigger. Things that may lead to or cause an SVT episode include heart failure, thyroid disease, smoking, drinking alcohol, too much caffeine, and certain medications. Depending on how severe the type of SVT you have, you will have different treatment methods that include medication or surgery. Supraventricular tachycardia is almost never life-threatening. There is a 50% chance that SVT will come back after resolved. You can avoid SVT by not smoking, drinking alcohol, or caffeine. Studies have shown that these factors speed up the heart rate. Focus on decreasing your stress levels by incorporating relaxation techniques into your daily routine, such as eating a balanced diet, exercising regularly. That all keeps your heart healthy. I am now going to share with you how I overcame SVT. Ever since I was 9 years old, I had always complained that my heart was hurting. In other words, I was having really bad chest pains. For the longest time, my parents didn't think much of it, and my doctor said it was probably heartburn. When the heart pain became more frequent, my mom would sit me down and try to get me to relax, to slow down my heart rate. At age 14, my doctor referred me to a cardiologist, also known as the heart doctor. The doctor informed my parents that if I'm not having an episode, it would be like a rat in a wheel trying to find it. I was instructed to go to the ER if I had an episode that lasted long enough to get me there. Well, one night I came home and my legs were numb, my chest hurt, I was dizzy, and I could feel my heart beating really fast. My dad rushed me to the ER. My heart rate was 190, which a normal heart rate for an age 14 is 70 to 100 beats per minute. The nurse could not believe that I was still walking. I was taken down to a room where they did a cardiac test. It was called an electrocardiogram, also known as an EKG. An EKG is a test that records the electrical signal from your heart to check for different heart conditions. Electrodes, which are tiny, sticky pads connected to wires to a machine, are placed different parts on your chest to record your heart's electrical signals, which cause your heart to beat. The signals are shown as waves on an attached computer monitor or printer. Here I have an example of an EKG. It is what the doctor reads to diagnose SVT. As you can see, there are waves attached onto the sheet, which show your heart rhythm. Once in my ER room, the doctor was monitoring my heartbeat. I had blood drawn for the first time and was given fluids through an IV. My heart rate would not lower, so they had me try a few vagal maneuvers to slow the heart rate down. WebMD states that vagal maneuvers affect the vagus nerve. It's a nerve in the body that helps regulate heart rate and blood pressure. It consisted of blowing on my thumb like a trumpet, bearing down as if I was passing a bowel movement, and placing ice on my face while holding my breath. A few hours later, my heart rate was lowered and I was sent home. I was diagnosed with SVT. The cardiologist gave me two options, surgery or medication for the rest of my life. I chose surgery. A month before my surgery, I was prescribed beta blockers, which are medications that lower blood pressure and heart rate. My surgery was called a cardiac ablation. The Children's Hospital of Philadelphia explains that an ablation is where several large IVs, or small plastic tubes, are placed in the main blood vessels in the legs. Then catheters are advanced up into the heart. The doctor finds the abnormal heart signal, causing the heart to beat too fast and either freezes it or burns it to obtain a normal heart rhythm. The surgery took over 4 hours. My SVT was caused by adrenaline. I was able to go home the same day, and now I have overcome SVT with no lasting effects. There are many things in life to help you have a healthy heart and to help you know the ways to overcome SVT. Number 1, know the causes and diagnose of SVT. 2, look at your daily habits to help lower your heart rate and prevent SVT. And 3, seek medical treatment if you are experiencing heart complications associated with SVT. I have now informed you on how and given you a better idea of what SVT is like, how to prevent it from occurring, and how it affects people differently. There are many different causes of supraventricular tachycardia, but I have only informed you on a few. If you are experiencing SVT symptoms, I would seek medical treatment. When you find a heartbeat that calms the storm in you, hold it close with everything you have. Thank you, and I hope you enjoyed my speech.